Brummett here. I wanted to share a tip that I learned the other day with a patient. So I had a patient come in who wanted a single crown replaced on tooth number 8, and she had done some whitening, and we got the color up where she was happy. And when she came in, we were taking our aesthetic photos of her existing crown, and it was 35 years old, so it was a PFM, very opaque, and not a lot of interest in it. And so with replacing this, she wanted to match the teeth beside it, which were her natural teeth. And we all know how each tooth, it exhibits different characterization with the way the light hits it, the way it absorbs it, and just the overall color. So when we were looking at her shade, we were honestly torn between A1 and B1. So took the pictures before we took the crown off, took pictures of her stump shade, and then what I ended up doing, because I was slightly confused on what color looked best, is I decided to make a provisional of both shades. So I made a provisional with Luxatemp Ultra A1, put that in her mouth, had her look at it, took photos, and then I made another example of a provisional with B1 Luxatemp provisional material, put that in her mouth, took photos, and let her look at that. And she chose to place A1 on as the provisional and communicated that back to the lab. So that way, with their ability to make it perfect, we might need to use variations of both shades. But what was great about that is when you're working with a great company like DMG and you've got awesome provisional materials, I encourage you to schedule extra time, even with a single tooth, so that way you can really communicate with your patient. You can really hear your patient about what they are most wanting the outcome to look like. And if you do that, you'll have a lot less challenge at the end whenever you go to seat the crown if there are discrepancies in the color or they develop resentments about what they thought the expectation was going to be. Discussing all those things ahead of time really helps save you and the patient headaches at the end. So consider taking some extra time, utilize different shades if you have to really decide what the patient's going to be happy with in that final shade. Thank you.